I'm going to start with this 62-year-old female keratoconus patient who I've known for years. She had decades ago a corneal transplant of her left eye with irregularity and unfortunately recurrent keratoconus. And for many years, she's worn a corneal gas perm contact lens on that eye that really does not fit well. And in fact, actually, she continuously during the day has trouble with the lens decentering and actually expulsing from the eye. And it's not an exaggeration to say that if she would cough or sneeze, that lens could come out. It did provide her 20/25 vision, but I was able to talk her into being fit with a scleral contact lens. And so I was able to start a fitting process with her using the Europa Tangent design. I used a 16 millimeter lens, which is slightly off from the standard, which Lynette explained was 16.5 millimeters. The material, we really wanted to use a hyper decay material to maximize oxygen to the cornea, so I chose Optimum Infinite. And just as advertised and just as suspected, we really had to go steep with this lens in order to properly clear the corneal surface. So the base curve of this lens was 54 diopters to give us a sagittal depth value of approximately 5,500 microns. So this lens is really steep, really deep. And with a power of minus 1175, she is able to see a perfect 20/20. With this lens, we see that with the first lens and no extra modifications, that we get a perfect even landing zone fit. So the advantage of the Europa Tangent in this case is that the landing zone remains compression free, even when the design requires extreme sagittal depth. And despite some mild scleral shape asymmetry, we were able to use a spherical landing zone. So the patient is very successful and happy that she doesn't have to worry about her lens spontaneously decentering or falling out of her eye.